Okay, welcome to this tutorial of the knee, plate 39. The knee is one of those things that many of you have reference to. You may know someone who has had injury. You may have had a relative who has had a knee replacement. And so the knee is one of those joints that takes a tremendous amount of abuse from us, especially those athletes out there. As athletes, I won't say myself, but as athletes get bigger and stronger, we can get muscles stronger and bigger, but we can't really get our ligaments and tendons and all that connective tissue holding these things together. So the knee takes a tremendous amount of abuse in athletics. In this lesson, I'm going to talk about the anterior view. So we're looking at a right leg from the anterior view. So it's really important for us to get down medial and lateral here. So if this is the right leg, let's see, put your right leg down, figure out where that is. Which side would be medial? Which side would be lateral? Well, hopefully you know out here, this is going to be lateral. So I'm going to put it down here just so that it's out of the road. So down here's lateral, and over here is medial. Okay, that'll help us here in a little bit. And so what I'd like you to do is in a moment, I'm going to ask you to take these numbers and place them on the diagram where you think they fit. You should have this diagram in front of you. If you don't, then now would be a good time to go find that. And then when you come back, I will have placed the numbers where I feel they go. Now, I would tell you, you may have to add some lines. Some lines may not be there, so you may need to find approximately where those are located and add your own line in and then the number. So go ahead and hit pause now and add your marks. All right, and I am back, and hopefully you have yours done. And so I've put those things around the bone where I think those fit. I'm not going to talk about these again. I believe these are things that we have talked about in the past. So I'm going to clear my board. If you've not checked yours, then hit pause and check where you've put yours, then come back and I will move on. All right, so now I'm going to talk about these new terms down here, and all of these are connective tissue. All of these are either, we do have one tendon that we'll talk about, and the rest of the things are ligaments and cartilage areas. So let me start with a quadricep tendon. Now, notice how they do have the patella has been cut. It would have attached all the way up here, would have been over over the knee. And so all these muscles that you actually have up here, these are your quadricep muscles. There are 4 of them. That's why we call them the quads. We'll talk about those in probably about a month or so. We'll talk about the 4 quadricep muscles. But down here, you think this would have been all the way up here. So this is the quadriceps tendon. And we could do it called quadriceps. You have your biceps. You've heard of that. You've probably heard of quads and may have not known what those were short for. So this tendon is the quadricep and actually touches to the knee, runs all the way up actually into your pelvis where those muscles go. All right, now this is actually connecting bone to bone. So, and really this is called a tendon because there are muscles, but this is just bone to bone. So it's connecting your patella to your tibia at the tibial tuberosity. And this is actually the patellar ligament. So I'm going to put B right on top of there. Patellar ligament. Now our meniscus. Meniscus are pads of cartilage, extremely strong cartilage. Oh, and remember, we are looking from the front. Here again, I think I erased that. So over here, this is lateral, and here is medial again. Okay, so my lateral meniscus, and these actually sit right on the top of the tibia. So I would have right here, this piece of cartilage. You can just see it here. We'll see it better from the back. This would be the medial meniscus. Okay, so I guess I skipped over. So this is letter D. So there's our, I want to check these off as I do them. And then just inside here, right here, we would have that lateral meniscus. So that was letter C. Okay, so I've got those. I'm going to jump down here to the lateral and medial facets. These actually are in the patella. Now remember up here we had the condyle, so we had the medial condyle and the lateral condyle. These are facets. So facets are regions of bone where articulation is going to take place. They're usually concave. So these match up. This surface right here matches up with this right here. And this matches up with this right here. And so what we have here, so because this is the lateral side, this is the lateral facet, letter I. And so we got that. And then the medial facet, letter J, we'd have right here. Okay. And that leaves our 4 knee ligaments. So we have 4 main knee ligaments that hold our knees stable side to side and hold your entire leg kind of side to side and front to back. Now, the side to side are going to be these ligaments that are on the outside. So we're going to have one here. We're going to have one here. I'm going to do arrows here. Then we have this one right here, the arrowhead on the end. And then we have one on the back, and it's pretty dark back here. So here's the other one. So I've labeled 1, 2, 3, and 4. Now let's start with these crossing ligaments. These actually help your knee front to back. In fact, the anterior actually keeps your tibia from going frontward, and the one in the back is going to keep your femur from going backwards. They actually kind of support front to back your knee. So they are called cruciate ligaments, and they are called cruciate ligaments because they are crisscrossing. You get the idea. One is, oh, let me get a different color here. Let me grab some red here. So this front one goes over top, and there's one in the back that's back here. They crisscross. So the front one is the anterior cruciate ligament. And I've probably kind of ruined things here. So our anterior is letter E. Okay, so the front, and the back one is the posterior cruciate ligament. That's back here. Now, you have probably heard this is abbreviated the ACL and the PCL. The ACL is one that is injured more often and torn more often than the PCL, just kind of the way the way the injuries occur. The ACL gets torn when the tibia goes frontwards or goes forward, but the femur does not go forward. So if you can imagine somebody kind of planting and causing that injury. Okay, so those are our cruciate ligaments, our crossing ligaments. Then we've got our collateral. Collateral along the side, but connecting it together. So over here's, remember, our medial, and over here's lateral. So lateral side's always with the fibula, by the way. That's another good way of keeping those straight. So right here we have running. It actually connects all the way down here, and you see it running all the way up along the knee, and actually connects up here to the medial epicondyle. So the epicondyles are locations where ligaments and things, mostly usually ligaments, will attach to. So this was the arrowhead here. So this is the medial collateral ligament. So there's letter G. And this one's actually a little shorter, connecting from your lateral epicondyle of the tibia, or the femur, down to the head of the fibula. You have this ligament, and that is your lateral collateral ligament. So there's letter H. Now, how do these get injured? Well, the way these get injured, and usually the medial gets injured more often, you have to think about the force that things are going to go. And I'm going to undo these things. So over here, let me get my pen back, and over here, so this was our MCL, so your medial collateral ligament, and this is your LCL. If you would get hit from this side, so let's suppose that your leg is on the ground and somebody hits your knee this direction, which of these ligaments are going to be in danger of breaking? So if you think about what the knee is going to do, it's going to get pushed this way. Well, that actually doesn't do anything to this ligament. In fact, if this were to kind of buckle, that would actually go under tension. It would lose tension, but the MCL would get increased tension and would possibly break. And there's where you can get a torn MCL. So this is getting hit from the outside, which is more likely to happen, Now, the opposite way of that, so if we think if somebody gets hit, if somebody is going to get an injury and they get hit from the inside, so if their leg is down and they get hit from the inside, then this one is, the LCL, okay, the LCL running along here is the one that could be in trouble. And it doesn't get hurt as much. The two that you're most likely to, probably the two more common, are definitely your ACL and your MCL. Those are the two that get injured more often. All right, so I think I went through those. So if you need to go back through and watch any of this part for the front of the knee, then we're going to skip to the back of the knee, and nothing new, just a different view. So I would ask you to hit pause, go through and do these old terms again. We've got a few new terms and I've taken some off. We can't see the patella, obviously. So go through, and in fact, I might even encourage you, go through if you can see if you can fill all of these in. You should actually be able to do every single one of these based on what we learned from the last plate and in previous plates. And when you come back, I will have things labeled. So hit pause now. All right, so mine got a little messy. Hopefully yours isn't quite as messy as mine. Now, I should have left you, again, we were working with the right leg. We should have talked about medial, so hopefully you identified medials on the inside here and lateral knee on the outside. Remember, our fibula is always on the outside. Interosseous membrane, now, interestingly enough, I will point out that they're actually almost like a foramen that run through those. There can be some blood vessels that will run through that. We'll see those in a few months from now. We have some blood vessels that will run down the leg and then have to pass through to get to the back of the leg back here. If you examine my labeling that I have, the one thing that gets a little tricky is the meniscus. The meniscus, you can almost think of the meniscus as being part of the top of the tibia here, and this pad right here of the meniscus. So this would be our medial meniscus, and this would be our lateral meniscus. The meniscus is really kind of, it's partly cartilage, it's also where these ligaments attach to. So you can get an idea here, the posterior back here now is in the front, which is really in the back, and then the anterior is up here in front. Now we do have this little bit of a, what do I label F? F, lateral collateral ligament. What am I doing here? Where was I going with that? I'm not sure why that stopped right there. I should go all the way over right here. Why did I put my F over there? Why didn't I put F over here? I don't know what I was doing. Temporary insanity. Okay. So my lateral collateral out here on the outside. So that's the knee. If you need to go back through and watch this, please do. Practice those purpose games, practice that Quizlet, and you will master the knee, I promise. Thanks for watching.